Hi, I'm speaking on behalf of Protect Our NHS, a local campaign fighting for the ever-increasing privatisation and marketisation of our health service, and I want to make 3 points. First, how much do we all really know what's happening locally to our health service? Are we, for example, aware that from October this year, South Western Ambulance Trust will be run by national car parks? Are we all aware that Harmony, who run our local 111 service, and once a GP out-of-hours cooperative, was bought out last year for £46 million by Care UK, which in turn has recently taken over the running of Emerson's Green Treatment Centre from the US-owned health company UKSH. Did you know that Bristol-based Oasis Dental Care, a company with origins in a free, and I remember when I got free dental treatment, and then privatised dental care service, was recently bought for £185 million by the private equity company that also owns Pret-a-Manger. All this and much, much more represents the tip of an iceberg of cash leaching from the NHS into private hands. Spending on privately provided services by the NHS reached a record £8.7 billion last year, a jump of more than £3 billion since 2006. This is taxpayers' money, our money, going straight into private pockets. At a much more local level, how many of us know how our new clinical commissioning groups, CCGs, are operating? Or that the North Somerset Clinical Commissioning Group, which will be making major decisions about the future sell-off of Western Hospital, is actually chaired by someone who works for the private health provider Capita Simons. We all need to know what is happening to our local health service, and Protect Our NHS is trying to do this. Second, last week the Bristol Modernising Mental Health Programme hosted an event for potential providers of future mental health service in Bristol, part of the early procurement stage for community health services. Alongside small locally based voluntary organisations, charities and statutory health bodies, interested attenders included names from the following organisations: Barchester Healthcare and Signet Health, both with links to private equity investment and tax haven financing, both controlled by the Grove Group, who own Castlebeck, who ran Winterbourne View. Need I say more? Then there was Care UK, yes, them again, now controlled by a global private equity group, Bridgepoint. You probably know Alan Milburn and Chris Patton are involved in them, who also, by the way, own Oasis Dental Care. Both Care UK and Four Seasons Healthcare, another attender, have had their debts rated as junk status by credit rating company Moody's. Who else was there? Serco Health, who were recently strongly criticised by the Parliamentary Public Accounts Committee regarding the loss-making contract it held with Cornwall Council to provide out-of-hours GP service. This revolved around, amongst other major concerns, the doctor who told a worried mum over the phone not to panic unless her child turned blue, and where the child was later rushed to hospital with meningitis. Serco Health is unsafe health. United Healthcare Group also attended. This is an American giant aiming to control millions of pounds of NHS money, which has cheated the US health system again and again in the past decade and been fined tens of millions of dollars for fixing charges. I don't have the time to comment on others there. But we have one message to these types: you will not profit from local mental health services. And in challenging the CCG, who will be commissioning services alongside users, carers and public, we will use our NHS constitutional right in fighting all the way to stop these types of unethical, morally repugnant, irresponsible organisations gaining a foothold here. Finally, in addition to fighting... My final point, in addition to fighting to protect what is left of the National Health Service, we will fight to save Western Hospital from a private sell-off. And we will join up with people in North Somerset to keep it a publicly owned, publicly accountable hospital. We are currently being governed by a profoundly undemocratic government with no mandate for the passing of the Health and Social Care Act.
Mike, can you sum up?
Yes, we are being governed by a coalition of MPs and lords which borders on corruption in the way vested interests determine parliamentary votes on the future of our health service. And when Hunt announces that we should be limited to a prescribed number of GP visits per year, as was trailed yesterday, we should all be very worried indeed. The next step is health credit vouchers and required healthcare insurance. Please join Protect Our NHS. Just Google us and help us in our fight to save the NHS. Thank you very much for your support.